in the studio, I have Dr. Thomas too. When he was a teenager, his life took a turn when he was diagnosed with hepatitis B from a routine blood test. He felt isolated as he did not know who to talk to about his diagnosis and what his future held. The hepatitis B virus may have a vaccine that has no cure. So he decided to use his diagnosis to fuel his passion for hepatitis B research. Thomas is now a professor leading the Store Liver Center at the Westmead Institute of Medical Research. His research focuses on detecting the different virus forms and how they contribute to the infection, persistence, and the liver cancer that is associated with chronic Hep B infection. On top of his research, he is the founder of the online forum hepbcommunity.org. This forum connects people living with Hep B and the health expert community. Thomas's research and advocacy has not gone unnoticed. He has received numerous awards. Most recently, Thomas was awarded the Mark Farmer Memorial Award and was highly commended finalist for the Sydney Awards. So you can also go to westmeadinstitute.org.au, people, researcher profiles, Dr. Thomas II biography. Welcome to the studio. That's a lot of a bio there for a doctor. So how did you get started in this field when you were in school? What did you want to study?
Oh, when I was growing up, I wanted to be all sorts of things. I wanted to be a psychologist. I wanted to be a doctor. I wanted to be, at some point, a stand-up comedian. But it turns out I wasn't really funny, so what I took that off the list. But as I grew up and went through high school, I found out I missed out on my cutoff to get into medicine,
Oh, what
much to the disappointment of my parents.
Adelaide?
And
Oh, Dr. Thomas, what is the score you need in Adelaide?
oh, I don't know, it was something like 98 out of 100, and I think I got 97.1. I'm not trying to show off, but I'm just saying I missed out. Um, and so I thought, oh, I'll just do medical science, which sounds very similar, and I'll try to work my way into medicine later. And then I found out that the lab on campus was studying hepatitis B. Now, as you said before, hepatitis B, I was diagnosed with that when I was about 15. And I thought, wow, maybe that's some sort of way that I could make a difference. Because I have the condition, I might be able to do something about it. And so that's when I sort of got into this sort of research. So from maybe second year onwards, in my university degree, I wanted to head to that lab and do, some research in that lab. I ended up doing honors and my PhD in that lab, and ever since I've just been really passionate about hepatitis B research.
Dr. Thomas, what were they doing at that time in the labs? What were they researching?
What were they researching? They were researching a lot of different things. One was a new cure for hepatitis B. Hepatitis B is a virus that has no cure at the moment. So that's one of the main things that the hepatitis B field is really dedicated towards is trying to find out why hepatitis B stays in the liver for so long, for a person's entire lifetime after someone's infected, and figuring out ways to clear it. And essentially, the whole lab was within that topic. The other field that the lab was interested in was how hepatitis B causes cancer. So hepatitis B is actually the single greatest risk or most common risk of liver cancer. So we um, we don't understand why, actually. The majority of people with hepatitis B were infected when they were kids, when they're actually being born. But the liver cancer doesn't happen till 50, 60, 70, 80 years later. And so what we're trying to figure out, or what my PhD was about, was looking at how the liver changes over that entire amount of time so that we understand how the virus is actually changing things to make it more likely that the liver becomes cancerous. And as a result, trying to figure out ways to overcome that or interrupt that process. So essentially stopping people from getting cancer.
So the virus itself, has that changed over the years?
Yeah, that's a really great question. And to some extent, yes, but for a long time, it doesn't change much at all. So maybe for the first 30 years of an infection, the virus just infects the liver and produces a lot of itself for, yeah, decades without changing very much. Our immune system, the system that the body has to get rid of these infections, doesn't recognize it at all until, for some reason, it looks in the liver and says, hey, that's not supposed to be there, and tries to kick it out. Okay. So that's when you get a lot of the liver inflammation, you get a lot of the liver damage, and that's sort of what causes ongoing problems, such as scar tissue formation. And what the virus does then is start changing quite a bit to sort of escape the immune response. And so the immune response adapts again, the virus changes again, the immune system changes again. So you get this constant immune activation, this constant inflammation, and that's what causes the big problems. So the virus is quite clever in terms of getting around our, security system, and it's that process that really worries us.
So what do you think? So how can you get this disease? What are the ways to get this disease?
Yeah, that's an excellent question as well. In the in culture, hepatitis B has sort of been seen as this condition that's associated with something dirty, all right, and to do with dirty things. But the truth is, the majority of people with hepatitis B got it when they were born. It's a mother to child transmission a lot of the time, the majority of the time. As I said before, there's a long time for that the virus has that it's just producing a lot of itself. During that time, the infection is actually asymptomatic. You may not even know you have it. And it's that is why it's so dangerous, that it gets passed on from that mother to child without the mother even knowing. So in Australia now, this is part of prenatal screening. This is one of the big tests to be able to say, oh, you have it. Let's mitigate the risks of passing it to your child, either by um, lowering the amount of virus you have by medication, and also vaccinating your children so that they're protected for life. However, so these are the major, this is the major um, route of transmission.
So if a so the child, a vaccinated mother with hepatitis can still pass it to the child. Um,
So
yeah.
uh, yeah. So the mother, if they're diagnosed during that period or around pregnancy, they are able to suppress the virus through medications and completely prevent the risk of transmission to their child. So it's definitely within the ability, medicine's ability to be able to stop that infection from happening and stop that ongoing chain of transmission down the line. Yeah.
But if the mother is pregnant and she doesn't know she has Hep B, is there any chance the baby would have it?
Yes, there's a chance during birth that they get it. So it's mainly transmitted through um, um, uh, bodily fluid exchange, whether that be blood or something like that, particularly during the birth process. Yeah.
What food? Is it shellfish or seafood?
So that's a great question. So there are actually several different viruses called hepatitis viruses. So there's hepatitis A, hepatitis B, hepatitis C, hepatitis D. What you describe as shellfish and that sort of thing and dirty water, this is hepatitis A. Yeah, um, so I'll go back a little. All of these hepatitis viruses are completely different viruses. The only thing they have in common is they cause hepatitis, which is a liver inflammation. Okay. So,
The transplant, get rid of it if you have a liver transplant.
ah, um, usually not because there's so much virus in the blood. It can get infected again after. So there's a chance that a transplanted liver will get infected again. We can lower the risks by, medications and antibodies and all that sort of thing. Um, but yeah, there's no real cure for it at the moment. Yeah.
What's the life expectancy like? People are still living with this and healthily living their lives. What's the life expectancy?
Yeah. That's a great question as well. Um, so if it is managed appropriately, so if you go to the doctor and maintain monitoring and get medication when it's needed, people can live uh, essentially completely normal lives, normal life expectancy, essentially. Um, it's when the condition is not being managed, is you're not getting regular blood tests to find out what the liver is doing, is it healthy, and whether you'd benefit from that medication, that you get into trouble. That ongoing inflammation um, becomes an issue because the thing about the liver is that you survive quite well without, you know, half of your liver even. There can be a lot of damage to your liver and you wouldn't even know it. Okay. It's when it gets so bad that it becomes symptomatic, and by that time it's too late. So if you manage it early and prevent a lot of this damage, essentially people will be healthy for a lot of their life.
And the research you're doing, what exactly are you doing in the research?
Yeah, I'm continuing on a lot of the research from the lab that I did my PhD in. So exactly the same as I described before. How does the virus stay in the liver for a person's entire life? And we've been able to find a couple of potential candidates, drug candidates that might be able to reverse a lot of this. and we're still looking at how hepatitis B causes cancer. And I do this because um, I know from the community that this is really what people with hepatitis B really need to be able to get rid of the virus and be sure that they're not at risk of liver cancer. So that's what we build into our research. What we also do is reach out to the affected community and do the research on, what do people want in addition? So it's not all this, the aspects in the clinic that worry people. It's other things as well, such as stigma, such as discrimination, such as people's anxiety about what their lab results mean, or potentially transmitting it to other people, and trying to understand that. So we treat the condition, we treat the person rather than the condition, and try to make sure that the impacts of this disease in all respects are being mitigated. Oh, sorry, Rosh, you've gone on mute.
Not everybody will get cancer. Is that right?
Yeah, that's right. Not everyone will get cancer, but we don't know who exactly will. So we need to make sure that people are undergoing appropriate monitoring. So people with chronic hepatitis B should get uh, a blood test every 6 months, and once they're a bit older, they will get ultrasounds to make sure the liver is healthy, and just maintain that ongoing monitoring. You're right that not everyone will get cancer, and we're trying to understand that in our research. What makes some people more likely? What makes some people less likely? Are there tests that we can develop to make sure to identify the people most at risk, so that we can ask them to maybe undergo a bit more monitoring to make sure that they're really safe, and allow a lot of the other people at lower risk to not have to keep going for these tests, because, I know it myself. Having to take days off and waiting in the waiting rooms, no one wants to go to the doctor when they don't need to. And for these conditions that are asymptomatic, or you don't feel sick, so it becomes hard to justify it in your mind when you have to go to work, or you need to look after kids and all this sort of thing. Yeah.
Thomas, so when you're doing the research, you're looking at a lot of sampling of bloods from the community affected. So you're looking for things that might give a clue to solve this problem. Is that what you're doing?
Yeah, that's exactly right. What we try to do is make sure that everything that we study in the lab actually has something to do in in the patients, right? There's a lot of research that only goes on in, cell culture in a petri dish, or even just in mice. Um, what we want to make sure is that these results that we can get in these small scale models actually makes sense. A person isn't a mouse. So we really need to make sure that everything we do is translational into humans. These initial models can give us, the first ideas, maybe something is interesting before talking to the affected community and making sure that their sacrifices in terms of their time, and as well as their tissues, like blood, is worth it. We make sure to respect the community. myself being from it. Yeah.
Yes. And what about the people that are passed? Are they donating their livers to research?
Yeah, that's a great question. We try to make sure that um, we try to ask people that they're comfortable with doing that. Um, I am not generally in the clinical space. I'm more in the lab. But definitely these sorts of tissues have been valuable in terms of trying to understand the disease, particularly in cancer.
What's the biggest breakthrough now in the last decade?
Biggest breakthrough in the last decade in our line of research? Well, there's just so many. It's hard to highlight some people without ignoring others. But as a whole, um, I feel like hepatitis B is sort of coming out of the shadows, and there's now more and more um, drugs that are specifically tailored for hepatitis B. That might sound strange at the moment, but when when we look at what's used in the clinic at the moment for hepatitis B, these are all drugs that have been developed for other diseases first and found that they actually work in hepatitis B as well. This is because the research for hepatitis B has not been well funded. We know that 300 million people around the world have hepatitis B, but we don't fund research into it because a lot of the people with hepatitis B come from poor countries. So it's associated as something that happens out there, not in us rich countries, even though it is around. Okay. So when we compare it against a condition like HIV, HIV affects 10 times fewer people compared to hepatitis B, but it gets funded from 10 to 100 times more money goes into HIV compared to Hep B. Now, I'm not saying that we don't need that research for HIV, but I'm saying that we need to increase our recognition and resourcing of hepatitis B to make sure that we get more people and more options to be able to manage their disease. And that's already starting. It's still quite um, unequal in terms of funding, but it's becoming more recognized. And there is the starting of some dedicated medicines that are specifically against hepatitis B, designed only for hepatitis B.
And the Store Liver Center, how long has that been operating?
This has been operating for decades. I don't actually run the Store Liver Center. I'm a group leader in the hepatitis B section of the Store Liver Center, but we study in Store all sorts of liver diseases. We study specifically, liver cancer, fatty liver, uh, immunology of the liver, so that inflammation that I talked about, the different genomics, fatty liver disease, all of these different causes of liver disease. And yeah, so we've been running for at least a decade and really doing some amazing work both in the research but also in the clinic and also doing outreach into communities, particularly in Western Sydney, where hepatitis B is quite prevalent.
Thank you so much for joining the Busy Mums radio show today, Dr. Thomas. And it is really good to see that you're also advocating and supporting people living with this blood-borne disease.
Yeah, thank you for having me on the show, Rosh.
It's a very
Really,
important topic for the listeners in Western Sydney. Thank you so
yeah.
much, and we hope to have you again, possibly next year if you have any further updates. Happy to have this topic again.
Yeah, fantastic. Would love to have the ongoing talks. It's really
Excellent,
important.
excellent. Thank you so much, and have a great afternoon.
Yeah, you too.
Thank you. And I'll just get this onto the show for this week. Hopefully, I've got also a domestic violence topic and guide dogs.
Oh, great.
For the,
What a mix.
it's going to be a mix.
Yeah, yeah, yeah. No, thank you for hosting me on such short notice. I know that
Yes,
yeah, Samaya has just
my,
contacted you this afternoon.
yes, and she saw my message after 1 year. I messaged her like a year ago. She's only just seen. Must be very busy.
Yeah, yeah, yeah.
She must be
No.
busy. I said, "What's this? I messaged you 1 year ago." Just in time because I needed some guests for this week. And is there a hepatitis B safety week or anything? Awareness month or
We just came out of so last week was hepatitis testing week. Um, yeah, so everyone should know their hepatitis B status, whether they've got the condition or whether they have had the vaccine and are protected. Everyone should just know.
oh, that was last week,
Yeah, yeah, yeah.
awareness week. Okay, because there's a lot of different campaigns every week.
Testing week, testing week.
Testing.
Yeah.
Oh, right, right. Yeah, that's true because the vaccines lapse, don't they? People forget.
Yeah, yeah, yeah. Or just people don't know. And a lot of people, say, people who've migrated over from other countries may just not have had them or have forgotten them, including with all of their other vaccines. So essentially, if you get a vaccine when you're young, you're protected for life. Oh, you're on mute again. So.
You have to, it lasts a lifetime or you have to top it up.
Oh, you don't generally people don't need to top it up. As soon as they've got three of their, initial shots and boosters, and they have protective levels of antibodies, that's good enough. Yeah.
And how do you feel personally? Do you feel healthy, happy when you're living with it as a doctor and living with it?
Yeah, I feel healthy. I'm on medication, so the virus levels are quite suppressed and you know most of it has been, interacting with the community and having to listen, not having to listen, but listening to all of the stories that they have and their struggles with it.
Anyone,
It had its emotional
if
toll.
any one of our listeners want to join the headbcommunity.org,
Yeah,
how does that work? Every month you meet up on the online or how does it work?
it's an online forum, so people just can join and post questions, and there's a lively community to welcome them to, share their fears or anything like that, and help people navigate the psychological impacts, but also a lot of the practical impacts of you know talking to people about it in relationships and all of this sort of thing, which people do struggle with, and doctors aren't really that well equipped to address all of these issues, the day-to-day issues. They know the clinic side very well, but when it comes to human relationships, it's difficult.
And the Mark Farmer Memorial Award. This is
Yeah,
one of your recent awards.
yeah, yeah, yeah. I got that last month, I think.
Congratulations. And that must be for your work in research.
Both the research, but also public communication about hepatitis B to make sure that, it's out there, people understand it, people aren't completely afraid of it, or become, um, stigmatizing for it. So,
Absolutely. Yeah.
and it's also the advocacy work. So it's not only Hep B community, which is there to support people, but we've also started the first community-led advocacy body called Hep B Voices Australia.
Oh, good, good. That is very
Yeah.
important, and it takes one person to do that. I mean, if you didn't do it, somebody else might have. Who knows?
No, yeah, exactly. And so it's more to bring the voices of the people living with Hep B to a lot of the decision-making bodies. I'm talking about not only politicians and policymakers, but also the clinicians that are involved in, writing up guidelines and all of this sort of thing, making sure that all of those issues that I talked about, the anxiety and the stigma and the impacts on people's lives, they are carried through and making sure that everything is fit for purpose and everything, um, yeah, is recognized, particularly when it affects a lot of these people who have migrated to Australia and may not understand the system. And so we need to make sure that they get access to the care that they need, and it's not just assumed that people know the system inside out already. Yeah.
I think this is a very good, it's going to be a very interesting podcast to bring to our listeners. A lot of
Yeah.
the moms and carers, they would probably have a lot of questions, living with it. How are they going to
Yeah.
find their partner? They
Yeah.
have children that might have it. It's a really interesting, this will be a very important, powerful podcast. Thank you so much, Dr. Thomas, too, for even bringing this to the table and for um, yeah, for my friend to let me know that she's working with you to bring this to the community. This is so powerful and empowering, and it's very difficult because a lot of there's so many causes now in Australia, and everybody's fighting
Yeah.
to get some recognition, some funding. But shows like Busy Mums Radio, the Live FM, we can at least bring it to the listeners, and they can raise awareness. There's so many
Yeah.
topics I cover through the whole year. It's very powerful. Each one of you have really great um, uh, causes, and yeah, the least we can do is give the listeners a listen to this, and they can make their decision. And also, how can we donate to this cause?
Yeah, really appreciate your platforming this work and the importance
How can
of
yeah
the condition.
how can people contribute to the liver happy cause?
Okay, Store Liver Center will accept donations. Yeah, so just get into contact with me and we'll be able to
Okay,
organize something.
fantastic. Thank you so much. And I think we're
Right.
almost out of time. Any final words? I think we have 2.5 minutes left. Anything final? What would you like to do in 10 years' time? What are you expecting?
Oh, just so much. I can hardly you know s- understand what's happening next week. Things are just changing so much, I think.
That's great.
But I would like
Are you
def
collaborating with other hospitals? Is there other liver centers that you collaborate? You share, oh, look what we found. Have you got anything closer to finding out?
yeah. Yeah. So this is a global effort. There's Hep B researchers all around the world. I particularly collaborate with researchers in the US and Germany. I did 6 years of work in Germany to drink in the work that's going on in there. So. Also in 2026, I'm organizing the International Hepatitis Meeting. It's probably going to be in the Asia Pacific region. So that will be really exciting to have on a global stage, everyone come together and make sure that we're all on the right path
And
and
who would have thought
support
this is
each
so
other.
empowering for you as a 14-year-old to have come this far? And now next you're going on to the global stage. This must be very empowering for you. Not you're not feeling sorry for yourself. You're actually this might even empower other young people who have this condition to do this. This is
Yeah,
fantastic.
exactly. Yeah. Yeah,
Fantastic.
we definitely have a lot of students come through and yeah, want to start this research because they're personally affected. Yeah.
Oh, I'm sorry to hear that. A lot of students here in Sydney.
Yeah, like they not even personally, but they know people who have hepatitis B. It's actually quite common in a lot of
And common in Sydney.
countries.
Yeah, that's right. All right. If you have any
Yeah.
questions, we can contact Dr. Thomas on his at his liver center at
Yes.
Westmead. Thank you.
Thank you,
Okay.
Rosh.
Okay. Have a
Have
great
a great
evening.
day.
Thank
Bye
you.
bye.